everyone, and how are you doing? Kindly welcome to this YouTube channel. It is a nutrition educative platform that aims to guide, educate, inform, and empower you with information regarding nutrition. We help you make informed dietary choices while delaying, preventing, and eradicating diet-related conditions. So, on today's first ever video on this channel, I want us to talk about introduction of solid foods to your infant at the age of 6 months. So when I talk about introduction of complementary feeding or solid foods, I want to talk about 5 key things that you need to put into consideration during this period. The point number 1 that I will talk about, first I'll state them, then explain them further as we go on. The first point I want to talk about is the fact that you're only introducing your child to these solid foods, so don't expect them to eat a lot, and that is amount. I will talk about the texture and consistency. I will talk about the frequency. We will also talk about responsive feeding. So, and the fifth point that I will talk about is hygiene. So the first point we mentioned was the amount. Remember that during these, especially the first month of introduction of solid food, that's now the 6th month, your child's main source of food and nutrients is still breast milk. And this particular month, you're only introducing your child to something else besides breast milk. So you need to be very patient during this stage, because this is something very new that you introduce into your child. They might not like the taste, they might not like the texture, they might not like the consistency and all that. Remember, they are used to breastfeeding only, so you'll need to be very patient. And when it comes to amount, you give 2 to 3 tablespoons per feed. If the child can only finish 1 tablespoon comfortably, stick to that for a while, until when you see that they finish the first tablespoon and there are signs that the child wants more food, then you can give a second tablespoon. But do not forcefully feed your child or force your child to finish a whole bowl of food or uji or anything, because remember, your child's stomach is still tiny and it's the size of your clenched wrist. It can't take much. So work on the amount, give small frequent meals over a period of time until your child gets used to the solid foods. Point number 2 is the consistency and the texture. When you're introducing solid foods to your child, there are different approaches that you can use to introduce solid foods to your child. I will talk about these approaches in another video, but when you talk about consistency, make sure that the child's food is soft and nutritious. Don't make it too hard for them, and don't make it too runny on the spoon for your child's comfortability when feeding. Point number 3 is the frequency. Remember, during breastfeeding, it is recommended to breastfeed on demand, but the most you can go without breastfeeding your child is up to 3 hours. So the same thing is going to apply when you're giving foods. Give small frequent foods or frequent meals, and spread them 3 hourly. Like, if the child only takes a small amount of food, then you are still alternating breast milk and the food. So after every 3 hours, make sure that the child has fed something. It doesn't have to be the solid food. You're still measuring on the breast milk. So you can work on giving 2 meals per day to this child on the 6th month. The other point is responsive feeding, and I really think I've already touched on it when I was talking about the amount. Please pay attention to your child's hunger and satiety cues. There are signs that you will notice from your child that the child is trying to show you that they've already had enough of the food, or they don't like the taste of this food, the texture of that food. Please don't forcefully feed your child. Try and make meal times fun for this child. Allow the mess to happen during meal time so that your child Remember, your child is like, it's just, your child is a normal human being just like you, and when you're being introduced to a new food, you have to touch it, to smell it, to taste it kidogo before you can actually accept it. So be very patient with your child. Give your child time to form a relationship between them and the food. Point number 5 is hygiene. You need to make sure that your hygiene levels are very high, because during this very period, if you're in unsanitary environments or you don't practice proper hygiene, chances are very high that your child might develop diarrhea cases, which are not good for your child. It gets your child to lose a lot of nutrients, a lot of water, and weaken their immunity. So kindly follow up on these points on from the 6th month onwards while introducing solid foods to your child. So that is it for today on this channel. Kindly hit the subscribe button, like and share this video. Let us form this very nutritionally informed community together. Thank you, and see you next on our very informative nutrition video coming to you next week, same time, same place. Thanks for being here.